Hi, Dr. Whittington. This is Mary Corey, and I'm doing my personal philosophy of nursing education. I have decided to pick humanism. Humanism education is based on the teaching learning process that encompasses the value, worth, and dignity of all people involved. Humanism believes that students are responsible for their own learning and determine their own needs, goals, and objectives. Students participate in their own learning and assume responsibility for their education. This learning principle is in line with McKendree's mission statement of engagement for students and faculty. Humanism's belief that our students play a role in our own education and objectives is important in undergraduate education that fosters these concepts, which are learner activity, students actively participate in the learning process, cooperation, faculty and students work together, interaction, students work together in the learning process, and responsibility, students take an active role in their education. Humanistic approach for education emphasizes analytical problem solving and critical thinking skills. Personally, while I like this learning theory centered on its focus of analytical problem solving and critical thinking skills, in today's learning environment, critical thinking skills encompass what is expected of any practicing nurse and any new nursing graduate. According to Canada, nurses need critical thinking skills because it's a key element and essential to the learning and implementation of evidence-based practice. Nursing research is based on improving evidence-based practice for the profession and the healthcare industry. In addition, problem-solving skills and critical thinking skills are in line with McKendree's mission statement that supports academic excellence because nurses need these skills to be successful. I have picked Gene Watson's caring theory, which is a relational caring for self and others based on a moral, ethical, and philosophical foundation of love and values. Gene Watson's theory is considered humanistic in the fact that the theory is based on caring. Another aspect why I use Gene Watson theory is because it's focused on cultivating one's own spiritual practice towards wholeness of mind, body, and spirit. Her theory is basically holistic and encompasses the whole person. For education, her concepts that the nurse needs to be a caring, healing environment is important for nursing faculty especially. Some of her concepts that I felt were relevant to education are embrace altruistic values and practice loving kindness with self and others, model self-care and caring of others, honors own and others' gifts and talents, respects others, and listens to others. When faculty members model self-care and caring for others, they exhibit the trait of a mentor for their students. Faculty want their students to be successful and practice safe nursing care. According to Potter and Tolson, good traits of a mentor are confidence, good listener, motivator, effective communicator, advisor, knowledgeable, and positive attitudes. The mentor should also assist the student in the learning style that they prefer. These guidelines are in congruence with Gene Watson's caring theory of honoring one's own and others' gifts and talents, in addition to being respectful and a good listener. Another aspect or concept I thought was relevant to education: be sensitive to self and others by nurturing individual beliefs, personal growth, and practices. This is important for faculty and students. Practicing self-reflection demonstrates willingness to explore one's feelings, beliefs, and values for self-growth, transforms tasks into healing interactions, and demonstrates genuine interest in others. They define self-reflection as journaling, prayer, meditation, and artistic expression. Individual practices discernment in evaluating circumstances and situations versus jumping to conclusions. When students and faculty explore their beliefs, They are able to identify their own biases and beliefs that might interfere with patient care and also student teaching. Another aspect is use creative science problem-solving methods for caring and decision-making. By integrating these characteristics, which are aesthetic, ethical, empirical, and personal ways of knowing, with critical thinking for full expression of caring arts and science, the student and faculty are able to practice safe nursing care. As mentioned previously, critical thinking in today's environment is probably the most important characteristic. This concept is important for nursing faculty to use different methods of teaching to help enhance the learning of their students. Another concept was shared teaching and learning that addresses the individual readiness and lifestyle. Students and faculty, this is important for both, speaks calmly, quietly, and respectful to others, seeks first to listen from others, and helps others formulate and give voice to questions and concerns to ask healthcare staff. As nurse educators, we need to foster the ability to effectively listen to our students. Then as educators, we will be better able to address their learning needs and help them resolve any problem areas. Another concept is creating a healing environment for physical and spiritual needs. Again, for students and faculty, creating that healing environment respects others' routines and rituals, and pays attention to others when they're talking. Nursing faculty and students need to foster an environment that helps their patients heal and their students learn. Really paying attention to the patient and the student when they're talking is crucial in creating an environment of trust. There is a new culture change in the long-term care environment that is based upon respecting the patient's routines and rituals rather than the institution's time frames. Another concept is assist with basic physical, emotional, and spiritual human needs. For students and faculty, this is important. Views others as an integrated whole, respects others' individual needs, and respect others' perceptions of the world. Basically treats others' body carefully. This last concept of Gene Watson's caring theory really encompasses the nursing care that nurses provide to patients. It also covers her concept of wholeness, which includes the mind, body, and spirit of the patient. As individuals and nurses, when we respect other people's perceptions and beliefs of the world, we create a better society and working environment for everyone to live in. This last concept really supports McKendree's mission statement of responsible citizenship. In conclusion, nursing education needs to be based on science. By utilizing nursing theory, we ensure that our nursing curriculum is scientifically based. Nursing science also supports that we utilize evidence-based practice in our profession. As nurses, we need to practice lifelong learning to stay current on healthcare policies and practices. This also supports the last part of McKendree's mission statement of lifelong learning. And this is Mary Corey concluding my presentation. Thank you, Dr. Whittington. Yeah, I think they're both. That one's probably a little bit better, did I not? Okay, one more time and then we're. No, I'm not doing it again.